The treatment of cancer requires a team of healthcare professionals who together cover every aspect of treatment. This team will become your medical support network, and it is important you feel comfortable talking openly with them and understand their responses. In this section of the DVD, you will meet Gillian Blanchard, an oncology nurse, who will provide advice on how to prepare for appointments and get the information you need. She will also offer suggestions on how you can communicate clearly with your healthcare professionals so they know what you are experiencing. You will also meet Leanne, diagnosed with colorectal cancer, and her husband George, and Graham, who is dealing with prostate cancer, and his wife Annette.
Okay, so before a consultation, patients usually don't know what to expect before they come, and they usually don't know what to ask. They're intimidated particularly by the doctor giving them all this information. I guess they get totally overwhelmed with the situation. They go away probably not feeling like they got what they should have out of that consultation. They don't really know what happened.
Sometimes we feel we didn't get the information we needed. We'd get home and find we'd have more questions than answers.
The appointments went so quickly. Everything was a blur. I was so busy trying to digest what I was being told. I just wanted to hit the pause button, stop the whole show so I could take in everything that I'd heard up to now and try and get my act together for what I really wanted to know.
This is a time when patients are really, really stressed. And actually attending a consultation, which is of great importance to them, really causes them a lot of anxiety. Doctors are talking medical jargon with them. They don't really know what those things mean. At that point, they're so overwhelmed that they don't actually hear what is being said. We know that patients only hear a proportion of what you tell them in a consultation, and so when they're anxious, there's even less of a chance of them hearing the important things that are discussed in the consultation.
Yeah, once we got home, we felt that we couldn't remember too much of what had been said, so we found it disheartening.
Yeah, but I mean, my oncologist, he's an expert in his field, and I fully trust what he says, but just sometimes when he spoke, I just felt like it was a different language.
I didn't understand nearly as much as I really thought I would understand. I would just nod, not wanting to appear ignorant. I think I walked away with more questions than answers.
We just felt at the end of the consultation that we were sort of left in the dark, and that made us feel really, really quite anxious.
Couples really need to work out between them what they want to get out of the consultation, what each individual wants to know and what they want to know as a couple. And the best way that they can do that is sit down, have a talk about it beforehand, write down a list of questions, discuss it between the two of them, and then bring it to the clinic.
So for the first couple of appointments, we just tended to show up, but it became clear that we weren't getting the information we needed. So we made an appointment of getting together the day before, so we knew what we wanted and we had a clear goal for the appointment.
Yeah, that was really important for us, that we did talk beforehand, and that I knew what George's main concerns were and that he knew what mine were. And in the first couple of appointments, I wanted to talk about the side effects of treatment of chemotherapy, and when I asked the oncologist, he vaguely answered that, you know, it's different for everybody, and I didn't want to be annoying by asking too many more questions, but George understood that that was really important to me, so he continued and asked some more specific questions, and then we found out that there were some things that could help, and we got some reassurance that we could try different things to help with the side effects of the treatment.
Most people actually don't know what questions to ask. So they can use question prompt lists such as the Coping Together booklet, and there are many other reliable resources out there such as the Cancer Council that also have prompt lists.
What kind of cancer do I have and how common is it? Yeah, what's this one? How long is it likely to last?
I think that's a good question.
Yeah, probably. What about this one? Is there someone I can talk to about financial matters, like, so we know where to start?
Yep. Financial assistance.
And the common side effects and what can be done about these effects, absolutely.
If patients bring a list of questions and they give it to the clinic nurse before I see them, and I get a chance then to sit down, have a think about the questions, and I believe it actually helps me give the patients a better answer. Using question prompt lists, they certainly don't make the consultation any longer. In fact, they help make the consultation flow. It gives us a better idea of what the patient wishes to get out of the consultation, and certainly it helps us address their needs. We know that patients, when they use question prompt lists, it helps them to remember more, they feel less anxious and they have more control. It's a really good idea if patients continually bring their prompt list with them to each of the consultation. That way, if they didn't have their needs addressed at the last consultation, we can try and address it at the next consultation.
Before I decided on any treatment, I needed questions answered, mainly to do with the side effects of whatever treatment we chose. But this time I went in armed with a notepad, pencil and all the questions that I wanted answered.
That approach probably was easier because we were told things, but we also felt comfortable in asking the questions.
Bring a third party with them, that often helps, and I've seen that on many occasions, because then they are just purely the note taker, and it gives them something to sit down together after the consultation and read and go through and help them to understand what's actually happened during that consult. It's not unusual to see people also bringing recording devices to consultations. Certainly most health professionals are more than happy to actually have a recording device there, whether it's a smartphone or an actual recorder.
When you're talking to your doctor after you've first been diagnosed, it's like you're in shock. You don't hear anything. It's like you're switched off. So it's just so important to have someone to come with you, to have that second set of ears.
We made a real effort to take notes and record as much detail as we possibly could in that short time that we were speaking with the doctor. Being quite a quiet, shy person by nature, I found that I couldn't do this without having a caring partner by my side, because I would find it very easy to be overawed. And I think having that partner, that special person in my life, and at that moment, helped get through the whole deal.
The most important reason for them to take an active role is so that they actually feel empowered.
We realised it was our responsibility to let the professionals actually know our ideas and our questions, as well as all the side effects that Graham's been going through. It was our responsibility to let them know. We also had to let them know of how we were feeling about different circumstances, how it was impacting on us.
I feel like I need to be more assertive about insisting on getting answers.
Asking the surgeon to actually do a diagram really helped me, as all the medical terminology just sort of went in one ear and out the other.
When I ask the doctor a question and I have my answer, I'll repeat the answer back to him. That way, if I have misunderstood, well, I'm corrected, and if I haven't misunderstood, well, it reaffirms in me that I am on the right track.
It's really important that we know what's going on with patients so that we can help them get through treatment. The more information we're given and the more the patient tells us, the better we're able to form an accurate picture of what is going on. If they're not specific about a symptom, it's really hard to work out what the cause of that symptom is. So it's really important for them to describe it in detail. It helps us give them the best treatment. It also helps us nip any problems in the bud before they become worse. That really helps open up the communication in a consultation if the patient is specific. It also helps us get to the root of the problem much quicker. I'll ask my patient questions such as, when did your symptom begin? How often and when did you experience the symptom? Is it constant or does it come and go? How long does the symptom last? What have you tried to address the problem? Did this help? Is the symptom getting worse or better? Have you seen a healthcare professional before about this symptom? How long ago? What treatment did they recommend? Did this help? Do you think any of your symptoms are related to events in your life? How do the symptoms affect your daily activities? Once I know these sort of details, I can provide some suitable advice.
I'm just finding details are just so important on telling the oncology nurse and the staff of how long I've had symptoms for and what they're feeling like and what I've done to try and make them stop, and how it's affecting me from day to day. All that information, they can then give me, more specific advice on other things that can work with the side effects of the treatment.
Preparing for appointments is important. Use question prompt lists to ensure you get the information you need. You can increase the amount of information you remember from consultations by taking notes or recording the session. Be as specific as possible about your symptoms and circumstances. The Coping Together booklets and website have many strategies for enhancing your communication with your healthcare team.